Hi everyone, welcome to my channel. I'm Dr. Anju Sharma and today we will be talking about cardiac cycle, right? We have started CVS Physiology and we have completed some topic like functional anatomy and action potential part and properties of cardiac muscle. Right, now we should know what is cardiac cycle, and this is the most important topic of CVS Physiology. So we'll be talking about all the events in cardiac cycle. So first of all, we should be knowing what is cardiac cycle. So cardiac cycle is the sequence of electrical and mechanical events occurring from one heartbeat to another heartbeat. So basically between two heartbeat, whatever happens, whether it is mechanical event or electrical event, okay, so how basically blood circulation occur and which valves are basically closed and open, and how the electrical the potential change occur, and what are changes in ECG. So in brief, we should know about all the mechanical events, electrical events and pressure volume changes. Okay, so cardiac cycle is basically a sequence of all those events between two heartbeats, right? Okay, so cardiac cycle, when we talk about, we should know the duration of cardiac cycle, right? So we assume that 0.8 second duration is the normal duration of cardiac cycle. But this is not a fixed duration, because we always read in this duration, people think or students think that this is the real duration of cardiac cycle, but it doesn't happen like this. So it depends on what is heart rate. Okay, we'll talk about it later, but roughly cardiac cycle is basically divided in two phases. One is the contraction phase, which we call it systole, and one is the relaxation phase, which is diastole. So contraction phase when blood is ejected, and relaxation phase when blood fills into the chambers of heart, right? So that is cardiac cycle. Now when we talk about cardiac cycle, the picture which should come in your mind is these events which we will be discussing here: the mechanical events during cardiac cycle, the electrical events or the ECG changes, and the pressure and volume changes in basically ventricles will be targeting here. And all these changes will be explained by Vickers diagram. Fine, the graph, if you remember in cardiac cycle, there is a graph which students think that this is complex, but here we will see that this is very easy, right? Okay, fine. When we talk about duration of cardiac cycle, the overall duration is 0.8 second. First of all, let's understand this concept of 0.5 second. 0.5 second is basically when heart rate 0.8 second, 0.8 second. So this timing, basically it is not constant, because it depends on when we assume that 75 heart rate is there. So for 75 heart rate, if we calculate the duration of one cycle, 60 by 75 is 0.8 second. So for example, if your heart rate comes around 200, so 60 by 200, so this 0.8 second in place of this, there will be roughly 0.3 second. So that's how the duration of cardiac cycle, it changes depending on heart rate, right? So it is not fixed. Then when we talk about, so let's assume that the heart rate of a normal person is 75, and now we are talking about the cardiac cycle events. So this is 0.8 second duration, and within that 0.8 second, we know that there are atria, two chambers of atria and two chambers of ventricle. Basically atria contract and relax on its own pace, and ventricle on its own pace. Basically, so atrial cycle, cardiac cycle, atrial cycle is separate than ventricular cycle. And since ventricle is basically performing the major pump function, so we read this cardiac cycle in respect of ventricle cycle. Okay, so if we talk about atrial cycle, again it is divided in two parts: atrial systole and atrial diastole. 4.1 second only atria undergoes systole, rest 0.7 second it undergo diastole phase. And during this 0.7 second, we read cardiac cycle in respect of ventricles. That's why we read ventricle cycle, and in ventricle cycle itself we get atrial systole. That's how we complete cardiac cycle when we read only ventricle phases, right? So now we'll be talking about ventricle phases. Fine. So these mechanical events will be divided into, we'll start with the ventricle phase. Okay, ventricle systole begins. So first of all, in ventricle systole, what we have to understand here is that when ventricle systole begins, there are some phases. These are three phases basically. One is isovolumetric contraction phase. So to understand this, we should have a brief understanding of all the phases of cardiac cycle. Let's just have a look on all the phases of cardiac cycle, and then one by one we'll be discussing one by one. Okay. So these are phases of cardiac cycle which we'll explain one by one. Ventricle systole, 0.3 second duration, and it contains these two parts. One is isovolumetric ventricle contraction, which is 0.05 second, and other is rest 0.25 second is ventricle systole or ventricular ejection phase. Now there is rapid ejection and slow ejection, and rapid ejection will be of less duration 0.1 and rest 0.15. So it completes 0.25, right? So this completes the ventricle systole. Then ventricle diastole. Ventricle diastole is of rest 0.5 second. Out of 0.8, 0.3 has been done. So 0.5 second ventricle diastole, right? It has been divided in these three phases: protodiastole, which is 0.04 second, isovolumetric ventricle relaxation 0.06 second, ventricle filling, which is rapid filling, slow filling, and rapid filling because of atrial systole. Okay, so one by one now we'll try to understand what happens in each phases of these cardiac cycle. Okay, so this atrial systole is obviously the first phase, but you can write this after understanding the complete cardiac cycle. So here, just to understand very easily, we will start this cardiac cycle from ventricle systole, right? Okay, so I'm showing my notes for you because the students often get confused that we understand cardiac cycle but we don't know how to write it in exam, and that's why I have made these notes for you so that you can have a look on how basically you will be performing in exam. Okay, now let us try to understand how ventricle systole begins. Now this we will understand with the help of a diagram. Fine. So what happens basically, we have talked about that basically if you just revise the flow of blood through the heart, so this is superior vena cava, this is inferior vena cava, and through this the blood comes to right atrium, right? From right atrium via valve, which there are three cusps present. So this valve is called tricuspid valve. Tricuspid valve, right? And this tricuspid valve, via this valve, the blood enters to right ventricle. From right ventricle, there is pulmonary artery. Pulmonary artery, the lungs, the blood reaches to lungs. Fine. Okay. Then from lungs, the blood comes to left atrium via the mitral valve. There are two cusps present, or we call it bicuspid valve. Bicuspid valve, right? And from left atrium, the blood is pumped to left ventricle. From left ventricle, this is pumped to aorta. Now you can see in the pulmonary artery, this is pulmonary artery, and this is aorta. Aorta, right? This is the big vessel which basically transfer all the blood to body, right? And you can see there are also some valves present, these valves, and these are called semilunar valve present. Semilunar valve, okay? Semilunar, because of shape of these valves, semilunar valves, right? Okay, now you know that there are two valves present, the mitral valve, bicuspid valve, tricuspid valve, and two semilunar valve in big vessels. Okay, this point is clear, and the blood is pumped via aorta to whole body. So that's how the circulation begins. Now what we were talking about is basically we are talking about ventricle systole. In ventricle systole, the blood has been collected here in atria, and atrial systole has occurred. As we have seen, the atrial systole has occurred, and after atrial systole is ventricle systole coming. We'll cover it later on, because so ventricle systole, so atrial systole. So blood has been collected here, and then the atrial systole occurs. So that blood came into this ventricle. Okay, both the ventricles. Fine. Okay. So once the blood is collected here in ventricle systole, the first phase we'll be talking about here. The blood is collected and ventricle contraction begins because of ventricle depolarization. Okay, because of ventricle depolarization wave, the ventricle contraction has begun. So the pressure is increasing in ventricle, and here the pressure is increasing in ventricle, which is basically opposing, which is pushing these walls upward. If the volume is high here and the pressure is also increasing, which pushes these walls upward, okay, and which basically lead to shutting of these walls, which lead to AV wall closure. Fine. So this is now, since these walls are closed and these walls are already closed, so this ventricle is now acting as a closed chamber. This is basically contracting. The muscle is going to contract again. So the pressure is rising, but now this is a closed chamber. Okay, so that's why we call this phase as isovolumetric ventricle contraction. Fine. So we can, how we can write it? This is of 0.05 second duration. As ventricle starts contracting, because of ventricle depolarization, the AV walls are pushed toward the atria. Now you understood what we were talking about here. So that wall is pushed toward atria, which lead to AV wall closure, and AV wall closure produces the first heart sound. Fine. Okay. If so if this point is clear to you, let us just have a look on how we will draw this. So if we see this Wiggers diagram, if you can see the two concept we will be talking about here, the pressure. So we'll talk about ventricle pressure first and volume. So now we know that here. So here this we are talking about here. So once AV wall closes, this is now acting as a closed chamber. And since this is a closed chamber, nothing is going outside. So the volume, if we draw, volume will draw a plateau phase, a stable line. So there is no change in volume. Whatever has been collected, 130 ml is basically end diastolic volume, which has been collected during filling phase. And now this is stable. Okay. And then since AV wall closed, this is acting as a closed chamber. So for this much duration, this phase is isovolumetric contraction, but ventricles are contracting, so the pressure, it basically rises. Okay, so these two concepts, and because of AV wall closed, we know that this is first heart sound, and with first heart sound, R wave also coincides. So if we talk about ECG, the QRS complex, the R wave coincide with heart sound 1. Now this point is clear. Let's move on to the next phase. Now ventricles are a closed chamber. AV wall is closed, semilunar wall is closed. So this is called isovolumetric contraction phase. So this is right up of the previous phase. Ventricles continue to contract and it lead to AV wall bulge. Fine, which give rise to C wave of JVP. Fine. Okay, then what happens basically? Ventricle ejection phase occur. After this isovolumetric contraction, since we were talking about heart, we were talking about here, okay? So this was basically contracting, pressure was rising. So the dynamics of all cardiac cycle phases is basically where pressure is high and where pressure is low. So for example, this is a lumen and pressure is high here. For example, here pressure is 180 and here pressure is 80. Okay, so obviously if these walls are closed, it will push the wall toward the low pressure, and obviously the opening of wall occur. If for example vice versa happened, so previously there was high pressure and there was low pressure, which led to opening of these walls. So that lead to pushing of the blood here, right? Now here pressure will be more. So here for example pressure is 80 and here pressure increases till 120 and here pressure reduces as the blood is pushed toward this. So at that point again these walls get again backward push because of high pressure this side and lead to AV wall, walls closure, not AV wall. Okay, so this dynamics we have to understand everywhere in cardiac cycle. So wherever there is high pressure, it will push the wall on opposite side. Fine. It can lead to closure or opening of the wall. So the same happen in the large vessels. Okay, so what we were happening? There was an isovolumetric ventricle contraction. These were closed. These were closed. Now, since the pressure is rising and pressure in ventricle become higher than the vessels, again the same thing happen. It pushes the walls and lead to opening of semilunar wall. Okay, so opening of semilunar wall lead to the blood is basically ejected outward, which is basically the ejection phase, right? So let's see the write-up. Okay, so first is rapid ejection phase. What happens basically? Ventricle contraction lead to increase in pressure 120 mmHg in left ventricles. So left ventricle pressure is more than the aortic pressure here, which pushes the semilunar wall, lead to semilunar wall opening. Okay, now you understood what we were saying. Okay, this phase is called rapid ejection phase. So blood is now ejected upward because of opening of semilunar wall. These semilunar wall are open now and blood is ejected outward. Fine. So since blood is ejected outward, then what happens basically? Now the walls is open. So as the wall opens suddenly, there will be rapid gush of blood, rapid flow of blood, and after some time, yes, there will be slow ejection of blood. So next phase is slow ejection, which is of 0.15 second. Okay, so here basically what happens? Approx 2/3 of ejection phase occur here. 30% ventricle emptying occur. Approx 30% blood is ejected in this phase. Around 50 ml remain at end of this phase and diastolic and systolic volume. So rest all the blood is ejected outside. Only 50 ml remain in ventricle. 50 ml. Okay. So there was rapid ejection and then slow ejection. Fine. So this completes the ventricle systole. Okay, ventricle systole phase. Fine. So now if we see again this curve, then so first of all there was isovolumetric contraction because of AV wall closure. The ventricle keeps on contracting and pressure rises, which led to opening of semilunar wall. Right, once the semilunar wall open, the blood is ejected, and that's why the volume of blood in ventricles keeps on reducing. Right, so there is, because of forceful ejection, there is rapid ejection, and then there is slow ejection. Slow ejection. So after slow ejection, what happens basically? Again the same scenario happens. So if the blood is ejected, and here we have more blood, here we have more blood, and here we have less blood. So because of this, again the pressure here is high and here pressure is low. Because of that, again it pushes, this blood pushes these walls downward, and again which lead to closure of these walls. So what happens basically? This semilunar wall closure occur, which produces second heart sound. So if we see graph here, after slow ejection phase, the semilunar wall closes, and this semilunar wall closes, which lead to second heart sound. Now, are you clear? The semilunar walls are closed. If you see heart structure again, these walls are closed, and we know that these walls are closed previously. Right, now can you see this chamber is again a isovolumetric chamber, but since the contraction phase has been over and now relaxation phase has been started because of the repolarization of ventricles, now the ventricles are relaxing. Now, because of this relaxation of the ventricles and this phase, again this is a closed chamber, we again call it as isovolumetric ventricle relaxation. Okay. But in ventricle relaxation or diastole, we understand, we basically read these movements as two phases. Protodiastole, in which semilunar wall closure occur, and the isovolumetric ventricle relaxation, when the ventricle started relaxation after this phase. So how will write this thing? Let's see. So ventricle diastole, which is of 0.5 second. Basically what happens, left ventricle pressure is now less than aortic pressure, okay, which leads to closure of semilunar wall, so which produces second heart sound. So we have seen that, right? And second heart sound produced in protodiastole phase, which is of 0.04 second. Now ventricles are a closed chamber again, closed AV walls and semilunar walls are closed. Ventricles are now relaxing, so we call it isovolumetric ventricle relaxation phase, which is of 0.06 second. Right? So till this point we have covered ventricle relaxation in two phases, protodiastole and isovolumetric relaxation phase. Then comes is ventricle filling phase. Now that was a closed chamber. Now this ventricle was a closed chamber and this is relaxing. and this wall is closed, this wall is closed, and now the chamber is relaxing, so it will create a vacuum. Because of that relaxation, it will create a vacuum. And second thing, the blood has been collected here, the blood has been collected in atrium, so blood is present here and ventricles are relaxing, which keeps this suction on, which basically pulls these walls downward again. Because of that, there is opening of AV wall occur, fine, which obviously lead to ventricle filling, right? So ventricle filling has been divided in three parts: rapid filling, slow filling due to atrial systole. So when the walls open, so how will write up this thing? Rapid filling phase, you will write this is of 0.11 second. As the ventricles are relaxing, pressure drops. Because of that relaxation, the pressure is reducing in ventricle, and now they are basically acting as a vacuum. So AV wall open because of that, cause sudden rush of blood into ventricles. We call it rapid filling phase, right? Okay, then we move to slow filling phase. Once the most of the blood has been entered into ventricle, now the rest blood which is coming from the superior vena cava, or basically pulmonary vein, the blood which is continuously flowing, now this will enter into ventricle as slow filling phase. So 0.19, which is longer kind of, right? So slow filling phase. Then this is called diastasis. Diastasis means slow filling. So ventricles are relaxing and basically the blood is filling in the ventricles. Then after that, what happens basically? Now this blood is continuously filling in both the ventricles. So at last what happens is the atrial systole begin. So whatever roughly 30% blood, whatever is remaining here, that atria systole phase occur, which basically pushes all the blood, leftover blood, to the ventricle. Okay, now obviously this atrial systole is also contributing to the ventricle filling phase. That means this is also ventricle filling. So this is called last rapid filling phase due to atrial systole, 0.1 second duration, which completes the filling phase. And the cycle repeats from atrial systole again. At end of ventricle relaxation, 130 ml blood is filled, called end diastolic volume. So if you see these graph, we have covered these graph. So this is the ventricle pressures, which when AV wall close, so this is atrial systole, then AV wall closure occur because ventricle pressure is rising. Ventricle pressure is rising and ventricles are filled with the maximum blood, which is 130 ml. But because of AV wall closure, this was an isovolumetric chamber. Now there is no volume change, but ventricles were contracting, so pressure rises. Then because of the pressure rises, so more pressure in ventricle than aorta, which led to semilunar wall opening. Then semilunar wall, there is rapid gush of blood. It's basically rapid ejection phase, then slow ejection phase. Once the pressure in ventricle is less than aorta, semilunar wall again closes, okay, which produces second heart sound. So semilunar wall closed. So again it is a closed chamber, and that's why the volume here is basically the constant. Then because of this, since they are relaxing, AV wall again open, which led to again filling phase, right? So after that, the last phase of filling phase is basically contributed by atrial systole. Now you saw that this atrial systole phase we have already included in the ventricle systole now, right? So separately we don't need to explain atrial cycle here, fine. So this heart sound 3, when AV wall open, there was sudden gush of blood into the ventricle, which produces heart sound 3, and 4 is because of atrial systole. These are not normal heart sounds, so normally we don't hear S1, S3 and S4. So HS1 and 2 are basically audible normally. And if you see PQRS, then obviously P wave precedes the atrial contraction, so there is P wave before it. Then is AV wall closure, HS1. Okay, HS1 coincide with R wave. Fine. Then semilunar wall close produces HS2. HS2 coincide with end part of T wave. Okay. So this is all about cardiac cycle, and we have seen the dynamics of. Let's just revise it here. So what happens basically, the blood is collecting here and the atrial systole occur. Atrial systole pushes the blood here. Then blood came here, okay, which basically So pressure started increasing, which pushes these walls upward and lead to closure of the AV wall. Produces heart sound first. So once this pressure is high, then the aorta, or we can say left ventricle down, we can talk about. So if pressure here is high, then it will lead to pushing of the semilunar wall, lead to opening of the semilunar wall. Till then this is closed chamber. So then rapid ejection occur and slow ejection occur. Once this part is done and pressure here is high, then the ventricle, this lead to closure of semilunar wall again. Now the ventricles are relaxing, and this is isovolumetric ventricle relaxation. Obviously when the vacuum is created, ventricle keep on relaxing, they lead to opening of the AV wall, which lead to ventricle filling phase. Now rapid filling phase, then slow filling phase, and at last because of atrial systole, the ventricles again filled up, which basically completes the cardiac cycle. I hope the point is clear. Let's just revise it. So ventricle systole 0.3 second contains isovolumetric ventricle contraction 0.05 second and 0.25 second ventricle systole, which is nothing but rapid and slow ejection. Ventricle diastole 0.5 second, which contains protodiastole and isovolumetric relaxation of 0.12 second, and rest is filling phase because of rapid filling, slow filling, and rapid filling because of atrial systole. So that's how we read cardiac cycle and we perform cardiac cycle in exam. I hope the point is clear. So I have shown my notes also how to basically explain all waves and all the phases, how you have to show the Vickers diagram, and with the help of the heart image you can show this cardiac cycle. But in exam you don't need to draw this diagram. In fact all the phases you can write and this Vickers diagram you can show. So this completes the cardiac cycle. I hope this point is clear. If you have any query you can comment below. Thanks for watching. Bye bye.